Today we'll be discussing anthrax, also known as the bacteria Bacillus anthracis. Hi, my name is Adela Mohammed.
And my name is Joanne Maytree. Yay!
We will be discussing the following: statistics, anatomy and physiology, mode of entry, signs and symptoms, and treatment. Statistics include extremely rare disease, common around 1976, usually occurs in agricultural areas. Cutaneous infection is the most common mode of entry. Inhaling is the most deadly. A very low percentage will survive.
Anthrax is a spore found in soil, can lay dormant, and withstand a variety of conditions. It is a toxin-producing bacteria that secretes toxins that enters the body. It travels from the soil to animals to humans. Anthrax enters the body through the skin, intestines, and lungs. Once enters the skin, it causes local edema and necrotic lesions. In the intestines, it causes mucosal edema and necrotic tissue. In the lungs, it causes inflammation,
ultimately causing meningitis, shock, fluid buildup in the lungs, or death. Cutaneous infection accounts for about 95% of cases. It is passed through contaminated animal products or insect bites holding the bacteria. This can cause itching and inflamed bumps near the bite.
Gastrointestinal Bacillus anthracis accounts for less than 5% of cases. Generally follow after consumption of contaminated, poorly cooked food. There are two forms, oropharyngeal and another called abdominal anthrax. B. anthracis spores enters through the lungs. Once inhaled, the spores settle in the alveoli. However, anthrax spores will run into immune cells, which will destroy some. The surviving anthrax spores will continue their passage into the lymphatic system and accumulate in the lymph nodes of the chest, which there will become full-blown anthrax.
Let's take a closer look. Surviving anthrax replicate in the lymph nodes, where the spores become full-blown anthrax that release their harmful toxins. The toxins in the blood produce symptoms all throughout the body. If the toxins reach the brain and spinal cord, it will cause heavy bleeding and hemorrhaging. Bacillus anthracis is a gram-positive bacteria that forms spores. This adds to their virulence. After the bacteria leave the spores and generate into full anthrax, they release their harmful toxins throughout the body, also known as exotoxin.
Bacillus anthracis binds the cell receptors. Protective antigen is cleaved by furans, which forms oligomers that gain ability to bind LF and EF. Toxin complex is then internalized through the receptor-mediated endocytosis. Once inside, the P oligomer channels membranes allow LF and EF to enter the cells and cause cytotoxic effects.
Just for recap, there are three components that make up the anthrax exotoxin: the protective antigen, lethal factor, and the edema factor. Individually, they are harmless, but together they are lethal. This can disrupt the protein kinase pathway, impairing the cell's immunity.
Signs and symptoms. In the skin, it causes lymphadenopathy, discomfort, muscle pain, and flu-like symptoms. In the gastrointestinal, it causes bloody diarrhea, abdominal pain and swelling, intestinal necrosis, and blood poisoning. In the respiratory tract, it causes enlarged lymph nodes, airway obstruction, and shock coma.
The treatment is dependent on the mode of entry. Cutaneous and gastrointestinal can be treated with various antibiotics, including penicillin, deoxycycline, and amoxicillin. However, this does not help with the exotoxins the anthrax releases. Some antitoxins can help, but not always.